Vicki Liviakis. Welcome to Body Beautiful. This is a show where we chat with local professionals about the latest in cosmetic procedures and medical devices. Plus, we take your calls live on the air. With us today, we have one of our favorites here, Dr. Elizabeth Lee. We're talking about mommy makeovers. Let's see, check your calendars. May 9th, Mother's Day. Later, we'll be taking your calls, answering any questions you might have about mommy makeovers. Here's the phone number, 800-440-4884. We'll also be posting the number for the doctor's office, so be ready to jot that down. And before we get started, this is our caveat. We always have to say this. Any advice we give you today, you want to consult your own physician.
Absolutely.
Welcome back to the program, Doctor.
Thank you.
Mommy makeovers. Do you have to be, pretty fresh off of having a kid to have a mommy makeover, or can you say, wait 25 years and decide you need a mommy makeover?
If you've decided 25 years later, you can still come in and talk, because it's never too late. It might be too early sometimes. You want to make sure that you're done nursing for at least 6 months, and you want to give your body a chance to come back into shape before you even consider undergoing surgery.
Okay, for those who don't know what a mommy makeover is, what is it?
Well, mommy makeover can take multiple different forms, but our bodies change when we have babies and during pregnancy. So a mommy makeover involves some kind of procedure to the tummy and some to the breasts.
Okay, why is it though that at the supermarkets, you look at the magazines, the Hollywood moms who just had a kid, it seems like, the day before, next thing you know, there they are, back at a bikini, svelte. What do we owe that to? Airbrushing?
No, sometimes it's nature too. I mean, not everybody gets all stretched out and doesn't spring back into shape, but some of us do. And also, in Hollywood, it's kind of their job to look a certain way. So where a lot of actors will have, nutritionists, dietitians, a personal chef, a trainer, somebody working with them full-time, and of course people to take care of the baby. So looking at Hollywood is not really a fair way to judge how well we in the general public are doing.
Okay, and do you think they indulge in the mommy makeover as well?
And they might. It is a trend to do immediate tummy tucks, particularly with C-section deliveries, and I do those too sometimes. But the mommy has to know that she's done having children, and the C-section has to be scheduled.
Oh, okay. So that's really an important thing. We're going to talk about that later down the line. But so you're saying that is it after a C-section you don't spring back as easily?
Oh, no. After a C-section, you may spring back just as easily as if you had a normal delivery. But the thing is that if you have been really stretched out and you have the separation of the muscles and stretched out skin after your first pregnancy, and you're going to need a scheduled C-section, all that stretching is not going to get better with the second pregnancy. So it's completely appropriate if you have an OBGYN who's working with a plastic surgeon to plan to do the C-section and an immediate tummy tuck.
Okay, but again, if you've had a tummy tuck, it's not advised that you get pregnant again,
afterwards, right? Exactly. So that's why any kind of mommy makeover should really be done after you're done having children.
Okay. Now, what about, say, if you've had twins, triplets?
The more there are, the more stretched out you get, in general.
Okay, so who's best suited for a mommy makeover?
Really, anybody who has stretched out skin and muscles in the belly and has a change in the appearance of their breasts that they don't like. So that, mommy makeover will involve some form of tummy tuck usually. It can also be incorporate liposuction to the abdomen, and some sort of breast rejuvenation procedure, whether it be a lift, an augmentation, a reduction, an augmentation and a lift together. It really depends on what your goals are and on what you and your surgeon decide.
All right, all the stuff that we're talking about is after you've been to the gym, you've drop and give me 50, it's just not working. The sit-ups, the wearing those things called what, Spanx?
Right.
Girdles, whatever it is.
If you have to wear Spanx to cover up all the time, you might be a candidate for something like this.
All right, doctor, we need to take a quick break, but for more information about mommy makeovers, you can call 510-704-2170, or you can check out Dr. Lee on the web at artfulsurgery.com. We will be taking your phone calls and continue our talk about mommy makeovers when we come back on Body Beautiful.